Today we're going to talk about a little bit anatomy of the eyes and the retina. So I'm going to use this graph to elucidate the structure of the eyes. So basically, as you can see, here's the eyeball. The most front part is the cornea, and this blue layer is the sclera. This is the most outer layer of the eyes. And in the middle, as we can see, here is the lens, and here's vitreous. Here is the anterior chamber, which circulates the aqueous humor. So the aqueous humor mainly maintains eye pressure. The lens are mainly focus the lights back to the retina, which is the yellow part of at the back of the eyes. And as you can see, the pink layer, which is a choroidal. The function of the choroidal is mainly to nourish the retina. You can see the red and the blue, which consists which are the artery and venous. So here's the retina. Of course, the most important part. Here's is optic nerves. So let's take zoom in of the retina, which is the most important part of the eyes. As here illustrated, so the retina are basically there's 10 layers of structure. There's many cells layers and fibers layers. But the most important part is here the greenish one, which are the light perception cells. Those are so there's two types: the cone and the red rose. Here, the red one are the retina pigment epithelia. So the retinitis pigmentosa, which basically is those cells are normally they are in the most deep in the fundus, but in this disease, as you can see, they might migrate to the surface. So we can see when you do the eye examination, you can see from the back of the eyes using ophthalmoscope. So in this disease, here's a choroidal. As we mentioned, the mainly function is to nourish those cells here. In the retinitis pigmentosa, those cells, this layer, and here's the vessels. They are very narrow, and those layers are practically atrophied. So there's no nutrition going up to those cells. So those cells are dying. There's no function very well. So that's why the patients will lose their visual function, lose their side vision. That's why. But in here, back to our surgery, because these layers are atrophied, so the vessels are narrowed. We are doing a surgery. Practically, we isolate some of the muscle fibers here, which their function is to move your eyes. We isolate some muscle fibers, which are very rich in blood vessels. We implanted here in the blue layers. So after the implantation, the cells, the tissue itself will reconnect with these vessels well. And then will address the shortage of the blood supply to the eyes. So that's basically how function our surgery. Okay.